Hi, my name is Valeria, and today I will be presenting on how clinical decision support systems can be used to improve access to quality care and patient outcomes. This presentation in specific will be focusing on best practice advisories from EPIC, also known as BPAs. So this meeting will focus on why implementing a clinical decision support system is important for our organization. We will go over the selected system and how it can improve patient care, access, and health equity. We will also review each team member's role and talk about the next steps for moving forward with the implementation. So the reason for this project is because healthcare organizations continue to face challenges related to access, consistency, and quality of care. From a nursing perspective, delays in care or misinformation can directly impact patient outcomes. Without standardized processes, patients may receive different treatments depending on the provider or setting. These issues increase the risk of delayed intervention and highlight the need for tools that support more consistent and evidence-based decision making. Clinical decision support systems help clinicians make more informed decisions by providing real-time evidence-based recommendations based on patient-specific data. From a nursing perspective, these tools help identify changes in a patient's condition earlier and support timely interventions. They also improve access to care by standardizing how patients are assessed and treated. In addition, clinical decision support system enhances information literacy by organizing complex data into a clear, actionable insights, making it easier for both providers and patients to understand and use health information effectively. This task force is made up of professionals from multiple disciplines to support successful implementation of clinical decision support systems. I was selected as the lead in this project as a nurse informaticist. My role focuses on bridging the clinical practice and technology. Each stakeholder was intentionally chosen based on their expertise. Bedside nurses were selected for their direct patient care experience and workflow insight. Providers for clinical decision making, IT specialists for system integration, case managers for care coordination, and leadership for policy development and organizational support. Each stakeholder has a defined role in ensuring that the clinical decision support system is effective in practice. Nurses are responsible for integrating the system into daily workflow and using it to support patient care. Providers apply the system and recommendations to guide evidence-based clinical decision making. IT specialists manage system functionality and ensure proper integration within the electronic health journal. Case managers coordinate care across settings, especially during transition, and leadership supports implementation, reinforces policies, and ensures that the organization has the resources needed for successful adaptation and improved patient outcomes. The selected clinical decision support system is EPIC, especially the best practice advisories, known as BPA, which are integrated into the electronic health record. These alerts use patient-specific data to provide real-time, evidence-based recommendations during clinical workflow. From a nursing perspective, this supports early recognition of patient changes and timely interventions. Clinical decision support systems improve access to care by reducing delays, standardizing treatment, while also improving information literacy by presenting complex clinical data in a clear and actionable way. Best practice advisories are key functions of EPIC's clinical decision support system. These alerts are triggered by patient-specific data and appear in real time during the clinical workflow. From a nursing perspective, BPAs can help identify early signs of patient deterioration and support timely intervention. They also improve patient safety through medication and risk alerts. However, if too many alerts are triggered, it can lead to alert fatigue, which may reduce the effectiveness, so proper system design and optimizations is important. So BPAs rely on integrated patient data within the electronic health record, which allows information to be shared across departments and care settings. It supports better communication among providers and improves continuity of care, especially during patient transitions by using shared data. BPAs enhance interoperability and ensure that all the members of the healthcare have access to the same information, which helps support coordinated, consistent care. The information communication technologies that will be used will be the electronic health record, patient portals, telehealth, and mobile health systems. Communication within the task force will be maintained using tools such as Microsoft Teams, email, and shared documents. Weekly meetings will be used to review progress and address challenges, and all communication will take place on a secure platform to maintain patient confidentiality and support effective collaboration. So what are the next steps? The next steps include reviewing the clinical decision support system in more detail and developing a project and implementation plan. Staff training will be provided and workflows will be evaluated to identify potential challenges. A pilot test will be conducted, followed by collecting feedback and refining the system before moving forward with full implementation across the organization.